To this now, recent stats on the state of children vaccinations by the United Nations Children's Fund have revealed that the confidence among South Africans regarding vaccines given to children declined by 30% after the start of the pandemic in early 2020. Now, despite the falls, overall support for vaccines remain relatively strong. In almost half the 55 countries studied, more than 80% of respondents perceived vaccines as important for children. Now, let's discuss this further. We're now joined via Zoom by Christine Muhigana, UNICEF representative in South Africa. Thank you so much for your time this afternoon. So talk to us then about just some of the drivers behind this decline in confidence in vaccines that we are seeing.
Good afternoon, and thank you for the opportunity to speak about this very topical and important subject following the release of our flagship report on the state of the world's children's report. It is focusing this year on vaccinating every child around the world and also here in South Africa. So what we see as factors behind this perception of, less importance of vaccination of children are trust issues. It is about issues around the efficacy of vaccines. As you said, this has been exacerbated since the COVID-19 pandemic and the discussions around the vaccine against that particular virus. It is also possible, though we don't know exactly the extent to which this is, correlated or related to the COVID-19 pandemic. There are also pre-existing and ongoing factors such as, faith and in relation to taking a vaccine, or just issues related to other priorities, other issues that parents have to face that brings the priority for child vaccination lower than we would want it to be.
I mean, we just heard now the WHO also very concerned about just some of, these reports that are coming out about the hesitancy, saying that, misinformation and disinformation around vaccines is also something to blame. I'm interested in the 55 countries. So the report looked at 55 countries. Which of these countries reported the highest decline perception of the importance of vaccines for children, and what is being done in terms of engaging these countries?
So I am really focused on South Africa. So you asking me a very important question there about the, where it is the drop is the highest. So let me really quickly look. South Africa has a big drop, 30%, as you said, in perception. So I'm looking at the ranking here. We have the Republic of Korea at the bottom. We have Papua New Guinea. We have Ghana. We have Senegal. We have Japan, and then South Africa comes, after that. So a concern to see, where South Africa ranks there. But as you said, it's a global phenomenon. And it's something that UNICEF is concerned about globally, along with our partners such as WHO and the governments which we support around the world.
And just to give that global picture again, we also understand that 12.7 million children in Africa missed out on one or more vaccinations over 3 years. In the long run, and just focusing again on South Africa, how will these impact children? I mean, we obviously know that there's also the measles outbreak that South Africa was dealing with. How important then does it become for South Africa to, probably accelerate their drive in encouraging people to vaccinate?
Yes, it is very important, as you said, and I'm actually happy to report that the country and the partners that we work with here in South Africa are taking this very seriously. Catch-up plans and drives have actually been conducted since 2021, when we saw this decline in child immunization. And, beyond the children who become sick because they are not vaccinated against a preventable disease, some could pass on, could die. So it's really very important for the individual child, for the community, to build immunity so that children are not affected. And there are other impacts such as the time, energy, and emotion that it takes for parents to have to care for a sick child. There is an impact also on the economy. So many people have to take care of their children, it means that they're not, at work, they're not being part of the productive efforts of a given country. And it also affects the health system. If children have to be hospitalized, have to be brought to care, into clinics, into health centers, that takes away, the time and the energy and the efforts and the resources that would normally, or that would otherwise go to caring for other types of illnesses, which may not be preventable, such as the ones that vaccines protect against.
It becomes even more important, I would imagine, for vaccine hesitancy to be addressed, because we are heading to winter and COVID-19 still exists. It's still around, and maybe more cases could increase. As we head into winter, we know that, of course, improving this confidence that we are talking about around vaccines is government's role, to play, but there are other stakeholders. Talk to us about, collaborative efforts that are needed, and which stakeholders would have to come front and center and assist government, try and at least bridge this gap when it comes to misinformation about vaccines.
Absolutely. So this is it's a whole society, whole community effort. The government, of course, has a very important and key role to play in making sure that this disinformation or misinformation is countered in any ways that is possible through information. Having the public service and health system having the right information to convey to the public, to the parents, to the caretakers. But it's also a role. There's also a very important role to play by civil society organizations, by those in the private sector who are in the space of healthcare, to help counter this disinformation, misinformation, building trust in communities, in people, in how powerful vaccines are in preventing disease and death. We do realize that oftentimes it's a matter of individual also behavior and belief. So whoever is able to support this effort to make sure that a mother, a father, a caretaker is positively convinced of the impact, the positive impact that vaccinating a child can have, the more and the better we will all be. So we work with a whole lot of partners, including civil society organizations, but also parents themselves, to bring about the change and the trust and the positive relationship that we all have with the healthcare system, the body of science that's behind vaccines.
All right, Christine, thank you so much for your time this afternoon. Really do appreciate it. Christine Muhigana, the UNICEF representative in South Africa.